Good morning. My name is Professor Gritz, and I'd like to welcome you to part 4 of deviance. So this is where the fun part starts, because now we're going to get into the different types of deviance, right? And as you know, I made a slide, and again, it's not what I proclaim as deviant, but the text talks about different forms of deviance, and it starts with chapter 8 about drug use and addiction, and then it moves into drunkenness and alcoholism. There's also a chapter on suicide. There's also a chapter on heterosexual deviance, which includes areas related to pornography, adultery, maybe dancing, nude dancing, right? Prostitution, other types of sex work and the computer. So those are heterosexual forms of deviance. Then we, of course, have a chapter devoted to homosexuality as a form of deviance. And then we get to physical disability, someone who might have a physical difference. And then the last area talks about mental disabilities. But as we piggyback up to the top of drug use and addiction, that's actually a mental disability. It's listed as a mental illness within the DSM-4, which we'll get to. So I'd like to introduce our drug use and addiction, chapter 8. We're going to talk about what is a drug and what is addiction, really. And maybe you'll get some knowledge about maybe a family member or yourself. So when we look at deviant drug use, or drugs as deviant behavior, we're looking at it from two perspectives. We're looking at it as the drug taking as deviant behavior, and that's influenced by many psychological and cultural variables, social variables, because if I take this drug, it's deviant one place, but maybe that drug is not deviant somewhere else. So we're looking at the idea of drug taking as deviant behavior, and then also under the influence of drugs, there is deviant behavior. So some drugs actually contribute, as you know, maybe, or have witnessed, to deviant behavior. So that's how we're looking ahead. So what is a drug? If we were in class, I'd ask you about your drugs taking. But what is a drug? I always get, well, what do you mean by what is a drug? Is alcohol a drug? Well, your text lists a drug as any substance, natural or artificial, other than food, that by its chemical nature alters the structure of or function of the living organism. So what alters you? Think about it. Other than food, your caffeine, I'm sure. This morning, you know, I'm having, where is it, tea right now, right? My tea has caffeine. Drug, hello. All right, so we all talk about drug, but we're not interested in just caffeine. This is deviance. The class is deviant. So what is deviant drug use? Well, again, it's culturally relative, right? It's a drug that is not common within a social group. So some groups might think that this drug is okay, and some groups might see it as deviant, right? So how do we know if it's deviant then? Well, we look to the majority of the people. So if the majority of the people result in measures to prevent this type of drug-taking behavior, we would say it's probably a deviant drug. So the society really defines which drug is deviant. Illicit drug use is different than deviant drug use. Illicit drug means it's a drug that is unlawful, right? A drug that's unlawful to possess or use. So that's the difference between, you know, where we're trying to understand what is illicit drugs. And this deviant drug use or use of alcohol and drugs is a small snippet of what this area looks like. So you could take a whole course, as you know we offer, addiction, psychological issues of addiction and compulsive behavior, and we look at this type of deviance. But again, we're only spending the last 2 weeks of the course, unfortunately, on it, but maybe you all get more interested and maybe minor in that psych, right? So we have illicit drug use, that's having that drug that you're not supposed to have, or you can't use it or possess it. Then we have drug misuse. That's different than illicit, but again, it's a form of deviance, right? Misusing a drug is you can have it, but you're taking more than is prescribed, or maybe you're using it other than what it's prescribed for. You know, if you have a prescription for a drug and your friend wants it because maybe her back's hurting, or I might give it to, let's say I have a really bad back problem or a surgery, I have leftover pain pills, and then someone I know has a bad back and they ask me for it. That's not okay. That's illicit drug. They are not allowed to have that drug. There's no prescription in it, their name. Now, that's not okay, right? That's illicit. They can also get that drug and take more of it, then they're also misusing it as well. So we have substance-related and addictive disorders. That's what the chapter calls it. I'm going to tell you what we call it in the mental illness community, but when we say substance abuse and related disorders, it's a cluster of behavioral, how we behave, cognitive, what we think, and physical symptoms, right? Indicating that the individual continues to use the substance despite consequences. So this is just really easy. Are you using something and you continue to use it despite consequences? I don't know. If you, have some asparagus today, you use it, maybe you have a cluster of physical symptoms, you throw up, maybe you think, I feel nauseous, should I feel like this? You're thinking, I don't know, I wouldn't do it again. But if you're doing it again, well, that might be a substance-related and addictive disorders. But we'll get to more of the specifics as we move on into exploring these chapters, right? So how do you know if you have a drug problem? If it's culturally relative, one culture says it's okay, one culture says no, when does it really become deviant? Well, we use the DSM. The DSM is the Diagnostic Statistical Manual, and it's basically a book that we can all agree on. Well, if it's got this, this, and this, it's this. So if I was a doctor and you came to me and you had some sniffles, maybe you have some sore throat, I'd look at you and I'd say, I don't know what this is. It could be a cold, it could be a flu, it could be, I don't know, maybe the beginnings of strep throat. So I look it up and I look in my manual of a doctor and it tells me what it is. Oh, you don't have a fever? Okay, it's not the flu. It gives you symptoms because there's similar symptoms within each illness, but we have to specify it. So the DSM is here to specify the illness. It tells us, well, if it's got this, it's probably an illness. I want you to understand that as we move forward with research, we understand more and more about our social and human behavior, so we make changes. So our DSM, our Diagnostic Statistical Manual, is always changing based on culture sometimes and science. So we've changed it, especially when it comes to substance use disorders, or what we would call, it used to be called drug abuse and drug dependence. We've changed it. We used to have a separation of what we called abuse and dependence. So if you came to me maybe 10 years ago, I'd look at you and I'd say, you're telling me about something you're ingesting, and I have to decide, are you abusing it or are you dependent on it? And we looked at it as if you had consequences and continued to use, that was abuse. Dependence was something completely different. That meant that you had a physical dependence, so that if we took the substance away from you, you would have a physical reaction. Now, the reason we care about that is because that's how we judged them. At one time, if a drug didn't have physical withdrawal, or you couldn't, you weren't drug dependent on it physically, we didn't think it was a problem. Cocaine, hey, hello. So you might abuse cocaine, but as far as people dependent on it, when you took the drug away, you didn't die. If you took an opiate like heroin for a long time and then you took it away, you could die from it. Physical manifestation, physical withdrawal. So that's how we used to judge drugs, good drug, bad drug, until we saw that even though cocaine didn't maybe physically put you through the DTs or shakes, you certainly build up a tolerance that if you didn't have it, you could get dependent, irritable, right? Depressed. So we don't look at it as abuse or drug dependent anymore. It's a whole different classification. And I think that when we think of terms, and you tell me if I'm correct, like we used to have like addict. You're an addict. You're an alcoholic. Well, these are labels. And if you remember from, I don't know, label theory, you can suggest that they might have a derogatory effect on someone's self-esteem and how society sees them, and it perpetuates the stigma and certainly perpetuates the deviance. I mean, heroin, if you are a heroin addict and you are, you know, in say Amsterdam, they're going to see it as a real illness and put you in the hospital. They're going to treat it, not as a moral deficit, but something that is an illness, a brain illness. And we'll get to how society sees it a little later. As I said, we got 2 weeks to look at this. So I'm just doing an introduction, today's introduction, and then of course, when we visit again, we'll fall into some of the symptomology of drug use disorders or substance use disorders. So the DSM, the Diagnostic Statistical Manual, has 10 classes of substances, which we'll get to. You used to be a polysubstance user, which meant you use a little bit of this, a little bit of that, poly. Now we don't have that. You would meet the criteria for each different drug, the 10. And we took the stigma away. It's not, like I said, you're not an addict, a dependent. Those are terms society uses. What we have is use disorder. And we'll talk about it from mild to severe. So there's degrees of severity, right? Not everybody looks the same. Just like we had labels to designate different types of criminal behavior, because not all criminal behavior looks alike, right? We have different types of labels that we use on your disorder from mild to severe, because we can't make it homogenous. As we've talked about in society, we like to label something and make it no gray. There's a lot of gray, right? So we have substance use disorder. That's the term. Substance use. We all use substances, but it's now become disordered. I don't know. I like that term. It's less stigma, right? 10 classes of substances. We have substance-induced disorder. That means you got a disorder from the substance, use intoxication, right? So if you go into the hospital and you're under the influence and like a lot of withdrawal, a lot of anxiety, what is the result of that? That's the substance-induced disorder. Now I want you to understand it's not limited to just substances, right? Interesting enough, the DSM has now gambling, right? Gambling is now a disorder, and we'll talk about that one as we move forward. Internet gaming is under current review in the DSM, and we'll talk more about the DSM and a little bit more about mental illness as we proceed through this. So those are the categories, as I mentioned, 10 substance use categories, substance use disorders, and we'll talk about what are the symptoms of the substance use disorders. How do you get mild? How do you get severe? Be careful. Like, you know, are you mild? Are you severe? Nah, you're not any of it, right? So this is just a brief introduction into Chapter 8, and we're going to move forward as we look to different explanations for substance use disorders, ideology, where does it come from, and then also what do we do about deviant use disorders or misuse or illicit drugs. So we'll be able to address all of these issues. All right, thanks, and you have a great day.